Welcome to this explainer. Today, we're completely demystifying diabetes mellitus. We're going to shift our focus from just trying to understand the biological dysfunction to actually empowering you with a comprehensive toolkit for management and prevention. You see, diabetes is one of the most common chronic diseases in the entire world, and if left untreated, it can absolutely wreak havoc on the body. But as you'll soon see, it is also highly manageable. So let's take a quick look at our roadmap. We'll start with the mechanics of blood sugar, cover the types and causes, identify those critical warning signs, explore medical and lifestyle management, and finally, look at the surprising power of physiotherapy. All right, section 1, the mechanics of blood sugar. Let's look at the body's harmony and establish the baseline of a healthy system before we dive into what exactly goes wrong. I want you to imagine insulin as a literal biological key. In a healthy body, you eat, your blood glucose naturally rises, and the beta cells in your pancreas release these little insulin keys. This allows the glucose to unlock your cells and be used for energy, bringing your blood sugar right back down to a normal level. It is a perfectly balanced, elegant system. But with diabetes, this lock and key mechanism completely malfunctions. When insulin is either reduced, totally absent, or just plain ineffective, which we call insulin resistance, that glucose gets trapped in the bloodstream. It just cannot enter the cells. As a result, blood sugar steadily rises, the cells literally starve for energy, and over time, this cascade leads to severe long-term organ damage. Moving on to section 2, types, causes, and risks. Let's break down how this malfunction actually shows up in different patients. It is absolutely crucial to understand the fundamental difference between the two main types of diabetes. Type 1 is an autoimmune disease. This is where the body mistakenly destroys its own pancreatic beta cells. It produces little to no insulin and requires lifelong insulin therapy, usually showing up in children and young adults. Type 2, on the other hand, is the most common form by far. It starts with insulin resistance and a progressive decline in insulin production. It's definitely linked to genetics, but also heavily tied to obesity and physical inactivity. It traditionally develops in adults, though sadly we're seeing it more and more in younger populations today. And we definitely can't overlook gestational diabetes. This develops specifically during pregnancy. Now, while it usually resolves after the baby is delivered, it's incredibly important to monitor because it acts like an early warning system. It significantly increases the mother's future risk of developing type 2 diabetes down the line. Now, looking at the key risk factors, you'll spot things we just can't control, right? Like our family history and increasing age. But look at the rest of them. Obesity, a sedentary lifestyle, high blood pressure, high cholesterol. While you cannot change your genetics, taking a really hard look at these lifestyle risk factors is the absolute first step toward reclaiming your health narrative. Okay, section 3, warning signs and complications. Having identified the culprits, we now have to confront the acute and chronic dangers of leaving high blood sugar unchecked. You might be wondering, what does this actually feel like? Well, increased thirst, frequent urination, profound fatigue, blurred vision, and slow wound healing. These seemingly disjointed symptoms are actually your body's unified cry for help when its cells are starved of energy. In type 1, you might also see unexplained weight loss. Think about it. If the body can't use glucose for energy, it starts breaking down fat and muscle. It is essentially starving in a sea of plenty. Now, ironically enough, the treatment for diabetes can sometimes trigger its own acute complication, a severe drop in blood sugar, known as hypoglycemia. If a patient takes a bit too much medication or skips a meal, their blood sugar can crash hard, leading to sweating, tremors, extreme confusion, and potentially even a loss of consciousness. If a blood sugar crash like that happens, there is a highly effective, immediate action you can take to reverse hypoglycemia in a conscious patient. It's called the 15-15 rule. You simply give them 15 grams of a fast-acting carbohydrate, like a sugary drink or a piece of candy, wait exactly 15 minutes, and then recheck their blood glucose. It's a simple, structured response that can stabilize them before emergency care is needed. Though it goes without saying, if they're unconscious, that is an immediate medical emergency. We also have to recognize when symptoms escalate into full-blown emergencies. In type 1, a severe lack of insulin means cells can't get glucose at all, so the body breaks down fat at a dangerous, rapid rate. This actually turns the blood acidic, a condition called diabetic ketoacidosis, or DKA. You might notice nausea, abdominal pain, rapid breathing, and a very distinct fruity-smelling breath. In type 2, severe high blood sugar combined with dehydration can lead to a hyperosmolar hyperglycemic state, or HHS. Both of these are severe and require immediate hospital intervention. But what if your blood sugar is just moderately high for years? Well, over time, that trapped blood glucose acts literally like a toxin in your blood vessels. It systematically damages your organs. We're talking cardiovascular disease like heart attacks and strokes. It damages the tiny blood vessels in your kidneys, known as nephropathy, and in your eyes, causing retinopathy and potential vision loss. It even damages your nerves, leading to neuropathy. Which brings us to the very severe risk of diabetic foot disease, where ulcers and infections can unfortunately lead to amputation. Which brings us to Section 4, Medical and Lifestyle Management. It is time for taking back control. Here is where we pivot the story, because you are definitely not powerless here. You have the weapons to fight back and manage his chronic condition effectively. You know the old saying, to manage the enemy, you have to measure it? While daily glucose meters and continuous glucose monitors are fantastic for day-to-day tracking, the HbA1c test is really the gold standard for long-term monitoring. It gives your healthcare team a highly reliable 3-month report card on exactly how well your blood sugar has been controlled. When it comes to medical treatment, it's never a one-size-fits-all situation. For some, oral medications like metformin or SGLT2 inhibitors are enough to help the body process glucose more effectively. But for others, particularly as the disease progresses or in type 1 diabetes, injectable medications become necessary. This includes GLP-1 receptor agonists or direct insulin therapies, whether that's rapid-acting, short-acting, intermediate, or long-acting insulin, to replace exactly what the body is missing. And because we touched on nerve damage earlier, we absolutely have to talk about diabetic foot care. Neuropathy can completely hide the pain of a cut, a blister, or an ulcer on your foot. By the time you actually notice it, a serious infection might have already set in. So daily foot inspections, wearing proper footwear, never walking barefoot, and treating wounds immediately are absolutely non-negotiable daily habits for anyone living with diabetes. Finally, Section 5, the power of physiotherapy. Let's look at a frontline defense that is so often overlooked in standard diabetes care. You might be thinking, physiotherapy? Isn't that just for sports injuries or recovering from a car accident? How exactly does that become a frontline defense against a metabolic disease like diabetes? Well, it turns out targeted physical therapy acts as a systemic, whole-body treatment. Remember how we said glucose needs to enter the cells? Muscle cells are some of the biggest consumers of glucose in your entire body. Physiotherapy guides patients through aerobic and resistance training, which actively improves how well your muscles utilize that glucose, naturally lowering your blood sugar. On top of that, physiotherapists provide crucial balance and gait training. Since diabetes can cause that nerve damage and numbness we discussed, targeted balance exercises simultaneously protect patients from devastating falls and heavily reduce neuropathy-related disability. Which brings us to our final takeaway. Diabetes mellitus is for sure a lifelong condition. It demands daily attention to your diet, your exercise, your medication, and your blood sugar monitoring. You can't change your genetics, and you can't undo an autoimmune response. But equipped with this comprehensive knowledge, understanding the mechanics of insulin, spotting the warning signs early, and utilizing both medical management and physiotherapy, are you ready to take the reins on the daily choices that will completely rewrite your metabolic future?